All right, so this is our Partners in Conversation, and we have with us today, we're going to talk about healthcare price transparency. My name is Amy Graham. I am a student in the graduate program for Masters in Public Affairs, and I have with me Marjorie Carson, who's the Director of Quality and Risk. A little bit of background about myself. I'm the Quality Risk Coordinator at a hospital in Northwest Indiana, and I'm also a veteran. Marjorie, could you please tell us about yourself, your education, your certifications, your professional background?
Hi, yes, I'm Marjorie Carson. I'm currently the Director of Quality and Assurance and Risk. I have a doctorate in nurse practice, as well as an MBA, and several degrees under that included like an associate, bachelor's, and master's in nursing, and a bachelor's and a master's in business. So my professional background varies from being a nurse for like 20 something years and then being in quality for well over 10 years.
And could you explain to people, I know on the previous slide I had after your name like NEABC and CPHQ. Can you explain to people what that is?
CPHQ is actually the certification in quality. And the NEABC, I'm board certified as a nurse executive.
Okay, great. Thank you so much. So you're pretty well versed in the healthcare industry to discuss healthcare price transparency and, maybe the reasoning for it and those sorts of things, right?
Yes, I've worked again. I did talk about being in the healthcare for so many years, but I did work into the insurance industry for several years as well.
Okay, great. Thank you. So people are probably wondering if they don't already know what healthcare price transparency is and, kind of what the need for it is. And I think in today's world, people want to know what they're getting themselves into. And I think our current government administration sees that, and they're addressing it with putting in this mandate for different states and imposing this price transparency with organizations throughout the country. What are your thoughts on healthcare price transparency and like how it's defined?
I agree with what you're saying. Our current administration is really making a priority with it. Along with the administration, our CMS, which is the Centers for Medicaid and Medicare, they have made this a priority that all healthcare talks about this transparency. So how do we define healthcare price transparency? It's the readily available information on the price of healthcare services that together with other information such as quality indicators, etc., gives our consumers or our patients an opportunity to choose where they would like to go because they know exactly how much it costs and how they can compare things like quality indicators.
I'm glad you mentioned those quality indicators. Can you explain to people, so if they go down at the bottom, I have the Indiana Healthcare Transparency link. If they were to go to that site, what are some of the quality indicators that they could see that would show the quality of their care?
So along with the quality indicators, it would include like such things as readmissions. It would include such things as infections. It would include what we call our HCAHPS scores, which is called like, it's patient satisfaction scores with either the hospital or with their physicians, all types of things like that.
Great, thank you. So not only could people see the comparative pricing, but they could also see, infection rates between different organizations and hospitals throughout the area and that sort of thing, and, doctor communication and things like that.
You're exactly right. And it's giving consumers or patients information to compare because what we see now is that our patients are savvy. They want to get, and I hate to say it like this, but the best care for the price. And so giving them this transparency, they can say, hey, if I go to this hospital, it's a lower infection rate or a lower readmission rate, or patients are more satisfied with it, and then they can choose.
That's great. And would you also say that's why we need it, is for that very reason?
I think it's really important for us to, yes, to need it, to see the quality and then the cost. Because what we also need to talk about is that so many patients do not have insurance, or they have insurance with a high deductible. So if they have to come out of their pocket for more money, so let me get the best quality of care at the lowest price possible, because I have to pay more out of my pocket, come out of more out of my pocket. A lot of people do not realize that part, you know, as far as with the insurance companies as well. So it goes hand in hand.
Yeah. And I would say probably, you know, just their opportunity cost, they're going to have to, you know, they might have to pay a little bit more, maybe in certain areas of the country, but they'll get better quality care if I'm correct.
You are correct that because that's what we choose. I mean, we can say this in healthcare, but even goods such as a car or anything, you want the best for the best price. But even if I have to pay a little bit more for what's important to me, of decrease in infections, etc., yes, patients will have that choice to do that.
I think we've kind of touched on this, but um, I know you work in the healthcare field, but even as a consumer, what do you think this provides to patients, and why is it beneficial to have price transparency?
Because it brings more choices to patients, and also it makes the healthcare industry compete. When we realize that we have to compete with other facilities, I think we increase our quality of care, because we understand that the health patients are more informed, they're more educated, and they want the best. And so we have to be the best to have patients to continue to come through our doors, which is really important.
I had also found in my reading that there was a lot of issues with commercial payers as opposed to Medicare payers, and that was like a big push for the price transparency. People coming in without insurance, having to pay 100% out of pocket, were getting charged a lot more for the same service as a Medicare patient or an insured patient.
That is absolutely right, because you have that cost. Because what happens with most people do not understand with CMS or with Medicare, like if something costs like $30,000, they have a set fee that they're going to pay the hospital period, which may be $15,000 for that same type of treatment. And but if it's charging $30,000, they could do it to the commercial insurance, but Medicare has a set fee that they're going to pay for a particular service. So
That's
you're absolutely right. It's a difference.
that's very interesting. Um, and then also, we just talked about it. Where can we find healthcare pricing? I know for the state of Indiana, there's this link right here, and it also provides you with the quality measures that Margie was speaking about. So you can go in and you can compare hospitals side by side and look at, you know, find what's important to you with your care, and kind of compare the two organizations to see where you would like to go. I know it doesn't really talk about emergent services, because they said that, you know, most people aren't really trying to price shop in an emergent situation, but it definitely shows like outpatient surgeries and that sort of thing.
Absolutely. And that's a great link to show that, because most people do not understand that sometimes healthcare facilities charge for the same procedure different if you're inpatient as compared to outpatient. And it goes back to what I was talking about with insurance and out of pocket. Patients are charged more out of pocket fees if you do it outpatient as compared to inpatient.
Okay. Yeah, that's very interesting too. And then I know you said you had insurance background, so this will be probably a great question to speak upon that. But what type of market failures within the healthcare industry do you feel led to price transparency becoming an issue and a factor in the type of services that people are receiving?
lack of a better term, price gorging, because what different industry, well, the healthcare industries or the different hospitals were charging different things. For an example, one hospital for pregnancy or delivery of a baby could have charged like 15,000, and right down the street they charged us 25,000. It wasn't monitored, and they just chose, what to charge.
I also found it interesting now too that hospitals have to make their charge masters public knowledge. Also, they have to put all that stuff out there. So if people really want to know what they're going to have to pay for a service, they can go on these sites, on these hospital sites, and they can look at that My Care Insight website, and they can also look at those charge masters and really go through and find out, different costs and things like that. I know insurance companies usually follow up after a procedure with a bill, showing you line by line what the procedure costs, but it's great that that consumers are going to have that tool as well to go back to and look at.
You're exactly right. And it's just like what you just defined, like insurance companies go line by line. Did I actually have to do this, or did I receive this? Because they found in the past, like a Tylenol may have cost $500, which only cost the hospital maybe 10 cents to get it. So with the charge master, but what we have to also teach consumers is that this is only an estimate, that charge master, because some other service could have possibly been performed while they were in the hospital. But that line by line, this is how much it's supposed to cost and how much I'm charged, you can't compare. That's really important, yes.
And then just some key points or takeaways I hope that people that are watching this understand is that I hope that this presentation provided them with the knowledge needed to kind of navigate healthcare sites. I know a lot of times as a patient, when you get your bill after a procedure and you're healing, you're just trying to understand how it could cost you so much out of pocket. And I think it's great now that not even just hospitals, but insurance companies, they have to be really transparent in deductibles and copays and that sort of thing. There can't be any hidden things anymore. Everything has to be upfront to the consumers. So I'm hoping that, with your knowledge that you provided, people can see this and get a better understanding of why this is so important. I also hope that this presentation allows for people to price check. I mean, just because you like an organization, that's great. But if you have to get an outpatient procedure and there's 2 hospitals close by you, maybe one has better infection rates, or maybe another one has better physician communication, and that's something important to you. So I'm just hoping that people see this and utilize that information and just kind of take responsibility for the care that they're receiving, because it's important, in the long run.
To add to that, just to reiterate, it's just like what you just said, to take the responsibility for the healthcare provider. That would just push this transparency is so important.
Because I feel like, we take so much time to buy the right car, to get the best cell phone service, to get the best cable provider, to buy the nicest house. But when it comes to our health, we need to invest in that just as much as anything else. So I feel like by putting this information out to the public, people can really do that and utilize that to their benefit.
I so agree, yes.
And then just to kind of wrap it up, here's some more websites. This is an employer hospital price transparency website. It's actually, it's called it was a 2019 study done by the RAND organization, and it's a really great video that discusses price transparency and the need for it, and gives consumers a better understanding of the importance of it. There's also the executive order discussing the need for healthcare transparency. And then this is that My Care Indiana website, and it kind of is a guide to help people navigate through that website. Do you have anything else that you would like to add, Marjorie?
No, these are very helpful links, and it's given like a comprehensive view of it, price transparency, and then you're talking about the client, I'm sorry, the quality link, and then the executive order discussing how important it is. So I would just totally advise anyone to go to those links, and they're very interesting.
I just want to thank you for your time and your expertise, and I really appreciate you taking the time out of your day to do this.
Oh, you're more than welcome.
All right. Have a great day.
Thank you. Thank you.
Thank you.